Hi everyone, welcome to week 11. We are going to get started with a mini lecture on post-traumatic growth. So let me share my screen and we'll get going. Alrighty. Just move the viewport around on my screen so I can see it. Let's jump in. And this is the first of two mini lectures for this week. And you will see the second one come up in your module as well. So what is post-traumatic growth? Well, we've been talking a lot about trauma and how to process trauma. And I think it's important to know that there can be positive changes that come as a result of trauma. Now, that does not mean that this always happens, and it does not mean that it has to happen or that a trauma wasn't severe if it doesn't happen. But I think, many times when someone goes through a pretty severe traumatic event, one result of them processing their trauma will be a type of growth that we call post-traumatic growth. I also kind of want to give the disclaimer that I think this is one of those things where the terminology of, everything happens for a reason may be thrown out. And I want to encourage you to be very careful about using that language. In fact, I would say don't use that language. It can be very diminishing for people's experiences and quite harmful. Just to use myself as an example, I have a chronic illness. I have had it since I was 17 years old. I'm guessing it's some form of epigenetics that caused it because they don't really know what causes most chronic illnesses. And yes, I've grown a lot and I have a lot of empathy and compassion for others as well as myself because of my lifelong process with that. But it didn't happen for any reason that I can come up with. And I do feel misunderstood, to say the least, when somebody says that to me in response to me sharing about my struggles. So that's a personal example, but there are lots of other reasons why I think those words can be harmful. But to switch back to what we're actually talking about today and post-traumatic growth, post-traumatic growth occurs when, and I'm quoting here, positive psychological change is experienced as a result of the struggle with highly challenging life circumstances. And that's from Tedeschi and Calhoun. So some things to know about post-traumatic growth. Experts really believe that post-traumatic growth only occurs if the trauma has been upsetting enough to the system, so the person, to drive that positive meaning making out of a life event. And so something can be pretty distressing, it can be traumatic, but it may not result in like a shift in worldview. But with post-traumatic growth, it really does. So there's something about this event that has changed the way that the person views life and their values. And as a result of that, they have some personal growth that comes out of processing their trauma. It's also, though, really important to note that post-traumatic growth does not discount how difficult it is to go through a traumatic situation or series of situations and events. And that doesn't mean that it's not very difficult for the person to process it, that this could take, months or years of work and investment and time and a strong dedication to wanting to, kind of return to their baseline self. But post-traumatic growth does offer a different perspective on life after trauma. You might never be the same person, but maybe you are, a different version of yourself that you still really like. There's been a good many populations that have been studied around post-traumatic growth, and I would encourage you, if you have an interest in this, to look up some of these studies. You can use the search terms post-traumatic growth and then whichever population you're interested in. I did link a few in your resources, but I didn't want to overwhelm you. So those include cancer survivors, chronic illness patients, the military and veteran populations, prisoners of war, HIV and AIDS patients, natural disaster survivors, prisoners, and refugees. So a good many people have been studied around post-traumatic growth. So when we look at correlational studies, we're looking to see what post-traumatic growth is correlated with or related to an increase in. And so these are kind of, and I'll talk more about this in a few, but these are kind of the things that you would want to work towards to facilitate post-traumatic growth. And those things include social support, your therapeutic relationship, and your ability to give empathy in a way that the client can receive the empathy, the client's work environment, their sense of coherence and being able to kind of make sense of their life, appreciation of life, optimism, a perceived benefit to the traumatic experience, and, you know, kind of a new purpose in life, a new meaningfulness that emerges. And it could be, you know, a focus on a passion, it could be an advocacy focus, it could be something else. But many times we do see that a renewed purpose in life is closely related to post-traumatic growth. Some of the benefits of post-traumatic growth include reduced suicidal ideation, a greater understanding of oneself, a greater compassion and empathy for others, which I think we all, you know, could benefit from. Acceptance of the process and acceptance of the events that happened. I think that that can be something that many folks struggle with, even outside of trauma, just in mental health, accepting where you are and using that as a starting point to move forward. So many times we stay in that, you know, kind of area of like, I don't want to accept that this happened. I don't want to accept that this is my reality. And that keeps us pretty stuck. So what else? Self-reliance and increased confidence in your personal strength, your personal resilience, and a reevaluation of priorities and values, which kind of goes back to that renewed meaning in life or purpose. So here's a question for you, and I'm not going to give you the answer because I want you to think about it. What factors do you think might inhibit someone from experiencing post-traumatic growth? You're working with a trauma client, they're processing, but they can't seem to kind of get to that next step. What might you look out for? I'd be curious to hear your thoughts on that if you want to share them with me or in the group discussion. So Tedeschi and Calhoun, going back to them, the dimensions of post-traumatic growth that they have discussed in the literature include changes in how we perceive ourselves, so seeing new possibilities or paths for their life, a change in the focus on interpersonal relationships, and so really having that desire to build warmer and more intimate relationships in their life, a greater sense of personal strength, which I talked about in the last slide, a change in their philosophy of life. So the priorities may move around. There may be more like taking time to really appreciate the day, less likely to stress over small things. And then finally, an increase in spiritual commitment or engagement. And I guess I'll just follow up with that by saying sometimes folks do become more spiritual and or religious after they go through a trauma and in their meaning-making process. And I would suggest that if that's part of their journey, that you join them in that and you explore it and find what's working for them. If that's not a part of their journey, that's okay too. And there are lots of ways to increase, you know, or find more connection, a spiritual connection outside of what we would normally talk about as religion. So really stay open to whatever this may look like for your client. So how can you promote post-traumatic growth? That's really important, right? This is the application piece. One, look out for negative outlooks and thoughts and work to increase optimism. So you can, you know, kind of offer a different perspective. You can reframe, which is often the therapy word for this. When we take something that kind of is negative and we try to reframe it in a different outlook to kind of highlight the optimism. Now, you don't ever want to ignore the fact that there may be some aspects of this that are still difficult and that sometimes a negative outlook certainly has served its purpose. But, you know, where you can, try to increase optimism. Next, actively engage the client in reevaluating their life goals. And there are two questions here, and you could literally just ask those. What used to be important to you before this trauma happened, and how has that changed? What is important now? So really good questions that you could spend multiple sessions exploring to help promote post-traumatic growth. Encouraging social support. Now, we really start with this from the very beginning, right? When we're treating trauma, because we know it's tough and people tend to isolate. And having social support greatly increases your likelihood of successful processing of your trauma. So, you just want to continue encouraging that. And especially if they are kind of through the processing, their symptoms have reduced, really engage them in discussions around new opportunities for social support. So maybe there are clubs that they now feel like emotionally ready to join, or, they have the attention to engage in new hobbies or things like that. So I think that can be a really great discussion as well. Next, work towards acceptance. Just like we talked about before, when you are not in a position of acceptance, it's very difficult to move to that next step where you're open to, figuring out how this has changed the way that you view the world and the way that you view life. And so, I kind of feel like maybe I should move that bullet point up, because it really goes under, increase optimism, or even in front of it. It's one of the first things that needs to happen for a person to move forward instead of staying stuck in, that very specific space and trauma. One modality that's particularly helpful for this is acceptance and commitment therapy. You can do trainings in this, kind of smaller workshops that you may be able to get through your state associations or webinars. They also have full, like, weekend long trainings where you can train with one of the certified ACT trainers. And I've had some colleagues that do that and really, really enjoy it. If you like mindfulness work, if you like, but I will say, if you like more directive mindfulness work, because I think ACT kind of combines those two things, that might be a good choice for you. And I've certainly used some of the activities from ACT to help clients, and I think that it can be a modality that resonates with a lot of folks. And then finally, explore new meanings and new stories. So, making meaning of our life events, like reflecting on them, reflecting on how they've changed us for better or worse. And if we want those things to stick, or if we want to move on past them, I think should be an active process. It's not, unfortunately, for many people. As counselors, we tend to be incredibly reflective. And so we do think a lot about, like, what things mean and making choices for our lives. And people that come into counseling may have never really thought about that before. And so, really asking clients about what their takeaways are from the traumas that happened to them can lead to a new purpose in life. And like I mentioned earlier, this could be, a sexual assault survivor deciding that they want to be an advocate and an educator in that realm, and pursuing that as, something that fills them with purpose and helps them make sense of what happened to them. And religion also may play a role in exploring the new meanings and new stories. And I've seen this happen. I've had clients who weren't particularly spiritual, and then they have like a really a late term miscarriage or something like that that is pretty traumatizing, or they lose a child to a car accident, and they find sort of this renewed purpose through spirituality and the belief that they'll be able to see their loved ones again. And so, once again, you don't have to share the client's beliefs, but it is your job to be competent around what they believe and encourage them to engage in things that help them recover. And so all of this needs to be very client focused around what's going to work best for them. And finally, I know I probably don't have to say this, but I think that it's important to remember, if you just stay the course of a good counselor, you are going to do good work. So be empathic, be genuine, give unconditional positive regard. Make sure that your clients know that they are not alone. You are their partner, and every chance you get, instill hope for a better future. And, the timeline for clients' recovery, it's going to look vastly different from one to the other, dependent on so many different factors. But oftentimes just having a partner there to witness their pain, to witness their growth, and reflect that back to them, and all of those little things, they really do instill hope and help clients to feel like they are getting better. All right, that's the end of this mini lecture. There are lots of resources in your module for post-traumatic growth, and I hope that you will check those out. Have a great day, and if you're watching these back to back, I'll see you in the next one.